Welcome back. Today we are going to continue our study of growth and development, and we're going to start off by discussing language development. So language development is first realized in the infant through crying. Crying is the first verbal communication that we participate in as humans. It is also followed up with cooing, then laughing, and then imitating the sounds of the grown-ups. By the age of 8 months, they may understand the word no, but they may not always follow this command. But I want to go back for a second to language development and crying, and I want to sit for this with a minute and think about how parents perceive the crying baby. Now, we automatically think when the baby is crying that they need something, and very often that is the case. And so what we want to teach parents in anticipatory guidance about crying is that crying can very much be a cry for I need my diaper changed, or a cry for I am hungry, or a cry for I want to be held. And so these are all very normal reasons for a baby to cry, and some parents can even distinguish different types of cries for different types of needs that have to be met. However, it's also important to consider that some babies are going to cry because that's how they're communicating. That's how they're expressing themselves. And I remember something that would happen in our household when my triplets were infants was a time of the evening that I used to call the witching hour. And so we could watch the clock, and almost on the button around 7 p.m., and this was during, I don't know, about maybe 5 months to about 7, no, not quite 7 months, maybe during month 5 to month 6. Every night at 7 o'clock, the babies would just cry, and they would just scream. And it wasn't because they needed anything. They were just blowing off steam. And so we would just kind of make sure their needs were met, the diapers were changed, the babies were cuddled, food was provided, they had been fed. We met all their needs, and yet there was still this little episode, this little burst of crying at this time of night, the witching hour, in which my husband and I a couple times just had to lay them safely in their cribs and kind of let them cry it out, because even holding them did not really seem to help. And so what I want you to understand, what I want us to be able to teach moms and dads, is that once we have met all the baby's needs, it's still normal sometimes for babies to cry. And so we have to know that it is not because of our poor parenting. We need to be able to teach them this is a normal part of a baby's growth and development, and that it's okay sometimes to just lay them down and let them cry a little bit, or else we might risk, child abuse, right? What we don't want to happen is for a parent to get so frustrated with a crying baby that they end up shaking the child. So this is very dangerous. It's shaken baby syndrome. It can cause brain damage in a baby. And so we want people to understand that once you've met the child's needs, you can safely lay the child down for a little bit and take a break, right? Take a break, mental health break. I think it's important for people to be able to hear that, because they might not understand that if we as nurses do not teach them. Or perhaps you may have a mother who comes in and says, every day at 3 o'clock, my baby just starts crying and I don't know why, and there's nothing I can do to make it stop. Sometimes this is referred to as colic in a baby. Traditionally, people have said it's from gas pains, it's from this, it's from that, it's from the other. There are things we can try to do to help with this, but generally speaking, we want to know that it can be normal. Okay? So, at the age of 1 year, they're usually able to recognize their own name. They may be able to speak 3 to 5 words with meaning, and they might understand the meaning of up to 100 words. Wow. I think we ought to consider the fact that we might not realize it, but the age of 1, they know the meaning of up to 100 words. So we might want to think about cleaning up our language earlier than we may have thought before, because they can hear us and they can understand us. So if we're saying negative things, if we're saying curse words, or speaking in this way, not only are they able to hear it, but they will really develop the understanding and meaning of it much sooner than we think. So Erikson is a theory. He's a theorist. His theories are surrounding psychosocial development. So psycho meaning, you know, our brain, social meaning our interactions with others. So cognitively, how do we you know, get the skill set for our social interaction? And what he teaches us about how babies engage with the people in their environment is during the birth to 1 year, they're in a stage called trust versus mistrust. And what this means is that a consistent caregiver must be able to meet the infant's needs in order for them to learn to trust this caregiver, and the result of this is that they become to trust themselves and they trust others and the world around them, and this actually results in faith and optimism moving forward in life. And so here we can see both a mom and a dad having this really kind of deep engagement with a baby. This is like this really close up kind of bonding that occurs with moms and dads. And I think it's important to mention here that this caregiver that establishes this initial trust doesn't have to be a parent, right? It can be a guardian, it could be a grandparent, it could be a caregiver. All that we know for sure is that that child has to establish that bond with another human in order to successfully master that first year of trust versus mistrust. And so in social development, we learn about separation anxiety. This usually happens around 4 to 8 months. It's normal. And what happens is the child experiences anxiety when they're separated from their primary caregiver. And so oftentimes, I'll give you an example. If grandma watches the baby all day while mom and dad are at work, they really see that individual as their primary caregiver, you know? And so when mom or dad might even come home, that baby might kind of cry a little bit because grandma's getting ready to leave now and mom and dad are home. This can be distressing to parents early on. But again, this is kind of a normal part of social development. And so it passes. The child is not always going to be so attached to grandma that they're not going to love their mommy and daddy. They certainly love their mommy and daddy, and they will. But this separation anxiety takes place. Of course, it takes place in the opposite way as well. So if mom and dad are the primary caregivers, but grandma comes over to watch the infant while mom and dad go out and get some well-deserved rest, the baby will be extremely crying, tearful, anxious when mom and dad go, because the baby is used to being with them, okay? Stranger anxiety develops a little bit later, 6 to 12 months, and this is when the child becomes distressed when exposed to people that are unfamiliar to them. And so one example of this would be that, you know, mom's at home with the 8-month-old and and the plumber comes over to fix the plumbing. And the child becomes quite hysterical when this stranger walks into the home because they are not used to seeing that individual. So they're very familiar with the people that they're often around, and so stranger anxiety happens around this age. There is also Piaget. He is another theorist around development, and his is more focused on the cognitive parts of development. So when we talk about cognitive, we're talking about thinking, right? So Piaget looked at the answers for how do children think, reason, and perceive the world. And so in his stage, which is birth to about the age of 2 years, learning about their self and their environment really through their sensory and motor explorations. This is called the sensory motor stage. And in this stage, we see that there's a baby here holding a rattle, and we know that they love to put everything in their mouths, and that's because they're exploring their environment, and part of the way that they do that is through that sensory feeling of sucking and having that sensation of putting something in their mouth. Other examples of this are reflex actions like rooting, blinking, yawning, coughing. Rooting is when an infant is kind of, if you put an infant up against a mother's chest, they'll kind of root. They'll turn their head and they'll root around kind of like a pig, you know, rooting, looking for, what they're actually looking for is the mother's nipple. They're trying to root around and look for that source of food. And that's a normal sensory motor thing that happens in newborn babies. And so motor actions like movement, we develop and grow those over time. Hitting, looking, grasping, these are all motor actions. And thought really derives from movement and sensation. And so sucking achieves a very pleasing result. So here we see a little guy who got into his mom's little seedlings. She had some little egg crates that she was going to start to grow some flowers in. But this little guy managed to crawl over and upset the dirt, and you come in and they're eating the dirt, and you're like, oh no, they're eating dirt. Well, guess what? It happens. It's going to happen. And what do we hear people say sometimes? Oh, it's good for their immune system. And truthfully, being exposed to different things out in the environment certainly does contribute to their ability to fight off infection. So even though we're not too happy when we see them put dirt in their mouth, it's gonna happen. And so I think, you know, the thing I might want to mention here is just that we really don't want to be limiting them all the time, right? So I want to try to teach parents to give the babies a safe space to explore their environment and not always running after them and stopping them and stopping them and stopping them, because, you know, we do want to keep them safe, and that's very important. But I think that sometimes people get really nervous about the infant getting injured, and we tend to get overly nervous about it. And I think that sometimes that can interfere with their ability to just kind of explore their environment. So again, encouraging people to make a safe place for them to roam around and do their thing, I think, is a really positive way to help kids explore. So object permanence is one of the things Piaget came up with. And he said that the child learns that they're separate from their environment, and that aspects of the environment continue to exist even though they may be outside of the reach of his senses. And what this means is that if you take a toy from a baby and you hide it underneath a blanket, initially they don't go look for it at all. They don't go look for it. They think that you took it away, you put it under the blanket, and it just disappeared. It's gone, okay? And, this can happen even when we think about this whole idea of separation anxiety, right? That at a certain time, when the parent exits, the infant, thinks that they've disappeared. They're never coming back again, which is why it can cause so much anxiety. But we notice that as the infant develops, at 4 to 8 months, they might reach for an object that's partially hidden, okay? Kind of indicating knowledge that the whole object is still there. So if an object is completely hidden at this stage, they'll still usually make no attempt to retrieve it. At 8 to 12 months, it's the earliest understanding of object permanence. When the infant is now able to retrieve an object, if he or she watches you hide it under the blanket. So you take their favorite toy, they watch you hide it under the blanket. Now they can go and seek it out and get it, expose it and say, and aha, right? It's so fun. You can almost play a game with them at this point as you hide something and they go try to retrieve it. And so it's believed that a child, an infant, takes such delight in peekaboo because he really thinks you disappear when they can't see you. And then, you disappear and then you come back again. You disappear and you come back again. And it's a really fun game to play, and it's all part of how they're growing and they're learning. And so I would encourage you to teach parents about these things. Teaching for a children or child in this stage, birth to about age 2, should be geared to the sensory motor system, right? With toys and different tasks that can help them learn about movement and retrieving objects. Behavior may be modified by using the senses. A smile, a frown, or a soothing or stern voice can really serve as appropriate techniques. So we know that by the end of the first year, they're really recognizing that they are distinct from their parents, meaning that when they see themselves in a reflection, that they really are identifying their own hands and legs and arms as being distinct from that of their caregiver. Because actually, up until this point, a lot of an early development, the child really thinks that they're kind of an extension of the caregiver. And so at the end of the first year, they're really recognizing their own distinction from their parents. So we are going to be getting into trouble once we kind of get through that first year, and now we can crawl all over the place. We can get into really fine, tight spots. We get to destroy the bathroom. And with all this fun, great motor movement, we increase risk for injury, right? And so in terms of safety risks, motor vehicle accidents are the leading cause of death of children in the United States. After that, it's aspiration of foreign objects. So, inhaling something and getting it stuck either in the throat or in the lungs, suffocation, falls, poisoning, burns, and drownings. And so these, again, are some of the anticipatory guidance that we want to be bringing to the parents' attention. So hopefully we can avoid some of these accidents. So in terms of car safety, newborns cannot be discharged from the hospital without appropriate car seat. And car seats do expire after 6 years. The expiration date is stamped on each car seat, and you are not able to use or sell a car seat if it has been expired. Birth to 20 pounds and up to 12 months of age, they are to face the rear in the back seat of the vehicle. So here we can see the farmer triplets. When I was thinking about getting pregnant, I bought a CRV, a Honda CRV, not realizing, of course, at the time that I was going to end up with 3. Fortunately, they actually fit in the back of the CRV, and this is them before the age of 12 months. Before they were 20 pounds in their car seats, and you can see that they're all facing the rear of the car. Once the infant reaches 20 pounds and is 12 months of age, they can have a front-facing car seat in the back seat of the car. However, experts recommend rear-facing until the age of 2. I had my kids turned around after they reached 20 pounds and 12 months because it is acceptable, but experts do recommend rear-facing until the age of 2. Child-proofing the home is very important. Remember, up until the age of 2, they will put anything in their mouths, and they require very close supervision. This is the triplets in their, what I used to call their jail, which was in the living room. They were separated from the kitchen, and the entire living room was completely baby-proofed. But they would come to this gate while I was working in the kitchen, and they would protest that they were being kept in their prison and that they wanted to be released. And eventually, the 3 of them got strong enough to knock this gate down and infiltrate my happy space in the kitchen. We had to figure out some other way to keep them from coming in the kitchen, where they would have access to things that could harm them. So, child-proofing the home, cabinets and cupboards need to be locked unless, of course, you're going to keep them out of those rooms. Caustic substances should be placed out of reach. All electrical outlets covered, and poison control numbers readily available. Children, babies like to crawl around and stick their fingers inside of things. It's part of that whole sensory motor thing, so we want to cover those outlets. Crib safety is another concern. We want to mention that drop side rail cribs, which I haven't seen in many years, are no longer manufactured and should not be used. It's illegal to sell these used on the internet or elsewhere. And the crib slats should be no more than 2.4 inches or 6 centimeters apart. So here we can see an example of correct sizing. These are the specs if you want to read about those. The Back to Sleep campaign was brought to everyone's attention sometime around the 90s, I think it was, and what it was a campaign and the prevention of sudden infant death syndrome, or SIDS. And so here you see a baby lying in the crib, really in the safest manner possible. And what I mean by that is that you can see that they are in a crib with no blankets, no pillows, no little bumper around the crib. The baby is in a onesie. The baby is sleeping on their back. And so this is the safest way. There's only one sheet on the mattress and is a fitted crib sheet, okay? And so this is the safest way to put an infant down to sleep. SIDS risk factors included maternal smoking during pregnancy, inadequate prenatal care, maternal age of under 20 years, and a premature baby. And so sudden infant death syndrome was when the child was put down to sleep. The mother comes in to check on them a couple hours later, and they've died. They've just stopped breathing. And so we want to try and prevent this from happening. So we always want to place the infant on their back for sleep, on a firm sleep surface, and with a fitted sheet. Never place them on pillows, quilts, sheepskins, or soft surfaces. We want to keep soft objects and toys and loose bedding out of the sleep area. We don't want to allow smoking around the infant. We want to keep their sleep area close to, but separate, let me say that again, separate from the caregivers. Co-sleeping with infants is dangerous. Why? Because a parent could roll over on the infant and suffocate them during sleep. And I know you might say to yourself, now really, how is that possible? Well, it is possible, and it does happen. And so they make these really neat things now, like these little beds that kind of connect to your bed, but they're actually in a separate bed. So they're like within arm's reach, but they're not sleeping in the same bed that you're sleeping in. So I encourage you to encourage others to make sure that you are not co-sleeping with infants. You want to keep them from overheating during sleep. So you don't want to put a real heavy onesie on them. There's actually evidence that a clean, dry pacifier is appropriate when putting infants down to sleep. And also providing tummy time to reduce the chance that flat spots will develop on the back of the infant's head, right? Because if we're always laying them down flat on their backs, their little heads can get flat. Now, it doesn't cause brain damage, but plagiocephaly is a flattened or misshapen head due to excessively lying flat. And this is kind of what it looks like. And so we want to provide plenty of tummy time so that babies not only develop some of those good gross motor skills, but that they're also not ending up with that little flat spot on the back of their heads. Although if they develop it, it will go away. So here is an example of all the things you are not supposed to do. Here we've got a little guy. He's in the crib. There's a little crib bumper. There's blankets. There's a little toy there in the crib. He's got his bottle propped up on a blanket, which is another no-no. And that's going to kind of take us a little bit into our next topic, which is the topic of bottle mouth. So juice and milk pools behind the upper front teeth, causing tooth decay. And so you can see here in these images, very early what happens is just this little bit of breakdown of the teeth, and then it gets worse and it gets worse and it gets worse until severe tooth decay occurs, and that's from the sugar and the milk and the juice. And so you can see in the image here that little nipple, how it goes up right behind those front teeth in the baby. And so we don't want to really leave them in the crib with the bottle or have the bottle in the mouth all the time, because it can lead to bad teeth. Okay, that kind of gets us into nutrition. We know that breast is best, and so breast milk is the preferred food of humans. However, it's not always possible for every mother to breastfeed. And so although we want to encourage our mothers to breastfeed their babies, we certainly don't want to shame anyone for making another choice, okay? We want to respect the choices of our patients because they are not our choices, all right? And again, we get into that thing where we judge and we want to advise, and that's really not what we're there to do. We're there to teach patients about the best possible thing that they can do. So we want to teach that breast milk is the first choice for the first 6 months of life. However, this is not always possible. An iron fortified formula, well, I guess I can't say is widely available in the current situation that we've been in recently. However, all the more reason, if you can breastfeed, to go ahead and do it, because there have been some shortages of formula as of late. Although just to know that babies can certainly grow into healthy adults with iron fortified formula as well. So supplementation for breastfed infants. Iron supplements might be added, and this would come from the physician around 4 to 6 months of age. Sooner in premature infants, And this is because children tend to start outgrowing their iron stores at about this age. So they're born with a lot of iron stores, and then as they're growing rapidly in the first 4 to 6 months, they kind of start to outgrow it. And so iron supplementation is introduced. Multivitamins are introduced sometimes, exclusively for breastfed, or when the maternal nutrition may be inadequate. And so parents can choose whether or not they're going to give the iron supplement or the multivitamins if they are recommended. That is usually the parent's choice. Fluoride supplementation tends to be sometimes a little bit controversial. Drops are prescribed by a pediatrician in a community where the water is not fluoridated. The water here is not fluoridated, and so usually the supplementation begins around 6 months of age, and evidence shows that they'll have stronger teeth and cavity prevention moving forward. So again, all the physician can do is recommend the use of fluoride supplement, and it's the parent that decides whether or not they're going to actually give it to the child. I did a little bit of research about it. Exceeding recommended dosage of fluoride, all that I can tell is that it results in fluorosis, which is in this image here. This is mild dental fluorosis, where if you get too much fluoride, your teeth get these kind of weird little white spots on them. And so again, there's not a whole lot of evidence showing that fluoride can do much else in excess other than cause this problem. So again, we want to try to educate people as much as possible, and I'll say it one more time, our water, at least I know here in Maui, is not fluoridated. So, nutrition. Introduction of solid foods around the age of 4 to 6 months. Solid foods meaning baby food, right? Solid foods. That is not to be confused with, formula. Formula or breast milk is given from birth up until around this time and continues to be given along with the introduction of solid foods. And so normally we might start with rice cereal. There are different brands. In the Hawaiian culture, they may be started with poi, which is all very good and wonderful as well. But why do we start with just one thing? So perhaps we just maybe start with the rice, or maybe we just start with the poi, because we really want to introduce one thing at a time. Okay? We want to introduce one new food at a time, see if the baby is tolerating it. When do we know? When do we know when the baby's ready for the introduction of solid foods? Usually when their birth weight has doubled. A lot of times this happens around 6 months, when they have good control of their head and neck, when they are a supported sitter. And you'll notice now, go into the grocery store and look to see on the baby foods, the different preparations of it will say if it's for a supported sitter. Able to turn their head away when they're full, showing interest in food when others are eating, perhaps. These are all signs or indications that they may be ready. And again, we want to introduce one food at a time to kind of identify food allergies. And you might say, so you're telling me to feed my baby carrots for like a full week and nothing else every day? How boring. Well, they're babies. They don't know any better. So yes, indeed, especially in families where there are a lot of allergies. You might want to find out early on if your baby has allergies. The way we're going to do that is by introducing things one at a time, okay? No honey or corn syrup due to the risk of ingesting Clostridium bacteria that causes infant botulism. This is no joke, okay? Honey, as wonderful as it is, isn't really safe to give during the first year. And that's because babies do not have the bacteria in their gut the bacteria that is in the honey can cause the baby to become sick. They're not able to fight that, okay? So no regular cow's milk until 1 year of age either. And the reason for this is because we find that if we give regular cow's milk before the age of 1, that they're going to have a higher risk of having other types of allergies. And so these are two things that we want to teach in anticipatory guidance. We also want to teach that weaning from the breast or the bottle should be happening between the ages of 1 and 2 years of age. And sometimes we'll use something like this kind of sippy cup where it kind of has a nipple on it, but it's kind of a cup, and we're kind of switching from the bottle. We're transitioning to a sippy cup. In our house, we kind of did it that way slowly over time. And then one day we were just like, no more bottle. Guess what? Gang, all gone. And there was probably some crying and some discomfort, probably for a day or so. And we just loved on those babies and gave them their sippy cup. And lo and behold, it was over, okay? So it's important to be able to wean them from the breast or the bottle. I would also mention that some mothers choose to breastfeed for a longer period of time, and that is perfectly acceptable. I mean, in third world countries, mothers will breastfeed up until the child is 4 years old, and I've seen it happen in this country as well. And so again, we must support them in their choice for how they want to provide nutrition for their babies. And so you may see mothers breastfeeding in public. We need to encourage them to be able to be comfortable caring for their babies in whatever way they see fit, as long as it's safe. All right, so let's talk about vaccinations. Oh, another topic that can get a bad rap, right? So the first thing we're going to do is we're just going to talk about what the whole point of a vaccine is, right? So when a bacteria or a virus enters our body, our immune system detects the organism, and our natural white blood cells, right, respond by creating proteins called antibodies. Okay, so we have this whole immune system response. We have our white blood cells come into play, and then what happens as a result of our immune system being activated is that we create these proteins called antibodies. Vaccines work by stimulating the immune system to produce these antibodies. Okay? To produce these antibodies. So what we're saying is a vaccine is introducing something very similar, okay, to whatever the disease is that we're trying to vaccinate against, so that the body will produce these antibodies. So antibodies work to prevent a person from becoming ill from this same bacteria or virus in the future. If a person is exposed to the organism again, the immune system recognizes it and rapidly produces more of the antibodies required to destroy the organism. All right? So this response protects the individual from becoming ill when exposed to the disease. So let's take a look at the COVID vaccine. So for example, how does the mRNA COVID-19 vaccine work? So the coronavirus, like the one that causes COVID-19, they're named for these crown-like spikes that are on their surface. These are called spike proteins, and they are ideal targets for vaccines. So you see these little spike proteins, you see it magnified with the magnifying glass there. And so what is mRNA? It's messenger RNA. It's genetic material that tells your body how to make proteins. And so what happens here is that the vaccine is made of mRNA that's wrapped in this coating that makes delivery easy and keeps the body from damaging it. So we inject this into the body. The vaccine does not contain any virus, so it can't give you COVID-19, and it cannot change your DNA in any way. What it does do is it teaches your cells how to make copies of the spike protein. If you're exposed to the real virus, later your body will recognize it and make antibodies to attack the virus, protecting you from COVID illness if you become ill, assuring that you will at least get a mild case of it, right? And so in this image here, we see the COVID vaccine injecting this messenger RNA to kind of help the body learn how to recognize these spike proteins and create these antibodies against them. So if we ever get exposed to the real COVID, our body will be ready with these antibodies to attack. So after the messenger RNA delivers the instructions, your cells use those instructions, do what they're supposed to do with it, break it down, and get rid of it. So when your body responds to the vaccine, you can have fatigue, headache, a mild fever. These are normal signs that the vaccine is working. My triplets just got their booster, and my two girls, interestingly enough, the identical twins, ended up getting a side effect from the vaccine, which is some lymphedema. They had a little bit of swelling underneath their armpit, both of them on the side where the vaccine was given. But again, this is a side effect, and it really kind of tells us that the vaccine is working. Their arm was kind of sore, their armpit was kind of sore for a couple days, but now they're doing just fine. So, newborn babies are immune to many diseases due to maternal antibodies, especially babies who are breastfed. There's evidence that there's all this good stuff that gets transferred not only maternally before the baby comes out, but after the baby is born in the breast milk. And so this immunity does not persist past the first year of life. And so before vaccines, many children died from diseases such as whooping cough, measles, and polio. And so here are some examples of polio cases worldwide in 1988, today, where we've come through the use of the vaccine. And here we can see a former president, FDR, had poliomyelitis, which left him in a wheelchair. You oftentimes did never see images of him in a wheelchair because they wanted to have him be presented to the country as being very strong. This is a rare photograph of him in a wheelchair. Another young child who you can see with a leg brace on there due to the weakness in the legs that gets caused. In the bottom picture, those are a bunch of nurses in a very large ward with a bunch of polio victims, little children in an iron lung. Because they were having difficulty breathing from the disease due to, again, to weakness of their breathing muscles. MMR is another vaccine example. It is against measles, mumps, and rubella. And here are some of those rashes that we can get. Mumps can occur. Rubella or the German measles, a little bit of information on that. But from the use of the MMR vaccine, we don't see these things much anymore. So in vaccines, the same bacteria and viruses, really exist today. All these things that we just mentioned, these bacteria and viruses, these diseases exist today. But because of these vaccinations, we don't see these diseases nearly as often, okay? So let's talk about the Tara Hill's story. Tara, I'm not sure how you would pronounce her first name. We're going to talk about the Hill family. This is a mom who had 7 children. Her and her husband were not for giving their children vaccines, decided not to vaccinate their 7 children. She was a homeschool kind of a mom. And we're going to talk a little bit about her story. Her 7 children all got whooping cough at the same time. And after that, she decided to get them all vaccinated and to get all their vaccinations and to speak out to other mothers about the risks of not getting your children vaccinated. So here's what she has to say to us. She says, when someone is talking to you about a very sensitive personal topic and their approach is hostile, human nature compels us to sort of close down, back off, and not want to engage. Okay? If the person, however, is warm and engaging, you feel safe. You might feel comfortable vocalizing your concerns and listening to what they have to say. Who is she talking about? Healthcare providers, okay? When her and her husband decided not to get their 7 children vaccinated, she felt judged. She felt hostility from doctors and nurses. And this turned her off even more, okay? We cannot treat people this way because it will keep them from coming in, seeking care, and getting vaccines. She says it's all in the approach, okay? This is just her true story, right? So here is her and her 7 beautiful children and husband. They all recovered from the whooping cough. But you can get online and you can look at her story about what it was like when she was homeschooling her 7 children and they all got whooping cough. She said it was one of the most horrifying experiences she's ever had as a mother. She would never wish it on her worst enemy, and she has since come out to be an advocate for vaccines. And so I want to encourage you to educate yourself and educate your patients about the safety of vaccines and the stories that are out there. So immunizing individual children also helps to protect the health of our community, especially those people who cannot be immunized. Who cannot be immunized? Children, first of all, who are too young to be vaccinated. So children yet less than a year old, they can't receive the MMR vaccine, but they can actually be infected by measles, mumps, and rubella, okay? So it's to protect them. It's also to protect individuals that can't be vaccinated for medical reasons, like children with leukemia, right? So kids that are getting chemotherapy, they have very, very suppressed immune systems, and we can't give them vaccinations, and so we are doing it also to protect them. And there are also some individuals in the community that can't make adequate responses to the vaccines, all right? So for whatever reason, we give them a vaccine and it just doesn't seem to work in them. When we vaccinate everybody else, what we're doing is protecting these vulnerable people as well. And so just going to kind of go through a couple. The hepatitis B vaccine, Hep B, protects against hepatitis B. The Tdap is a combined vaccine protecting against diphtheria, tetanus, and pertussis, or whooping cough. Here we see the Hib vaccine, the PCV vaccine. You can read about what they're protecting from. The polio vaccine, RV, protects against the infections that cause rotavirus, influenza, MMR, varicella, and hepatitis A. And so I hope you've learned something new today that you didn't know before. This was a picture of me and my crew when they were babies down by the Grand Wailea. in Kihei by the ocean, just enjoying a walk and taking a break there, having some time enjoying the sunset, as I hope you all do. Remember, it's important to take care of ourselves. And that includes a young mom with triplets who's working full time. It includes a nursing student who's juggling life and school and work and a family. So please take some time to take care of yourself and maybe watch the sunset, get some fresh air, or go to the beach soon. Until then, I will see you next time. Aloha.